everyone. I hope you're having a great Sunday. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 21 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. Let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that nature is the ultimate healer. Its roots go back beyond the time of Hippocrates, the father of modern medicine. Naturopathic medicine's core belief is that our body has the innate ability to maintain and restore optimum health, no matter what the current status may be. Therefore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability.
Well, that's enough about me in naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine so that you can get a better understanding of how this safe and effective form of medicine works. I'm so happy that you joined us because we have an incredible program for you today. Just the presence of today's patient, just the presence of today's guest is incredible in itself. Incredible not for who this person is, but for what this person has. Today's guest has been on Island Wellness television in the past, and if you saw or heard his story, you will certainly recognize him today. What makes Jason's appearance with us today incredible is because he should be dead. In fact, he should have been dead for several years now. Jason, thank you so much for joining us again.
Yeah, it's good to be here. Thanks for inviting me.
You're welcome. Jason, I want to thank you for letting us parade you out here again. But people are always asking me how you're doing. Is Jason still alive? Others want to know, sure, naturopathic medicine kept Jason alive for 3 years, but that could be just pure luck, coincidence. But what about now? Is he still alive 5 years later? So, Jason, you first appeared with me on the radio over 3 years ago, and then on Island Wellness television over a year and a half ago. Obviously, you're still here and alive. I guess we could just end our program right here, but you have a story to tell. But for those of you who have never heard Jason's heroic battle against the incurable genetic disease called von Hippel-Lindau disease, please stay with us. It will be a story that you're not going to forget. Jason, before you share your incredible journey of living with and beating this incurable genetic disease, von Hippel-Lindau disease, let me give our audience some important facts about von Hippel-Lindau disease, otherwise known as VHL. So von Hippel-Lindau disease is a rare autosomal dominant genetic disorder caused by a defective tumor suppressor gene at chromosome 3p25 and p26. This basically means that these individuals' immune system's ability to battle abnormal cell growth are turned off, resulting in rampant cancer growth. VHL is a rare genetic disorder. The incidence of von Hippel-Lindau disease is 1 in every 32 to 40,000 individuals in the United States. So I get different estimates from different sources. Von Hippel-Lindau disease is characterized by development of and or recurrence of retinal angiomas, tumors in the eye, brain and spinal cord hemangioblastomas, that's tumors in the brain and spinal cord, renal cell carcinomas, that's kidney cancer, endolymphatic sac tumors, pheochromocytomas, that's adrenal gland tumors, papillary cyst adenomas of the epididymis, angiomas of the liver and kidney, cysts of the pancreas, kidney, liver, and epididymis. Both sexes are affected equally. The diagnosis is established if the patient has more than one central nervous system hemangioblastoma, one hemangioblastoma within the abdominal cavity, or the disease, or one manifestation of the disease in a known family history. Genetic disorders like von Hippel-Lindau disease are typically untreatable and incurable. The prognosis for these individuals with von Hippel-Lindau disease is dire. Individuals typically succumb to the disease within a few years of diagnosis. The average lifespan is 49 years of age. Later on, Jason will tell you how old he is today, hopefully, maybe not. Okay. The typical conventional medical treatment is symptomatic, basically meaning surgically removing the tumors as it develops. Symptoms typically begin in the third or fourth decade of life. Diagnosis of von Hippel-Lindau disease is made through genetic testing. The tumors are monitored by MRI and CAT scans. An autosomal dominant genetic disease means that one parent has the defective gene and passes it to the child. This also means that each child of an affected parent has a 50% chance of inheriting the defective gene and the disease. Both sexes are affected equally, and all races are affected. Spontaneous cases of von Hippel-Lindau disease occurs in about 20% of all cases. This occurs because of genetic mutations at the 3p25 and 3p26 chromosome. 60 to 75% of the individuals with von Hippel-Lindau disease are affected by renal cell carcinoma, resulting in the high mortality rate and low life expectancy. Renal cysts in themselves are seldomly clinically significant. However, in VHL, they have an enormous rate of malignant transformation. The average age at which patients with VHL develop renal cell carcinoma is 44 years. The second most common cause of death in patients with VHL is central nervous system hemangioblastomas. Approximately 70% of affected individuals develop these tumors. The mean age of diagnosis is 25 years. 80% of these central nervous system tumors develop in the cerebellum, 20% in the spinal cord. Although hemangioblastomas are usually benign, the continued enlargement of these tumors within the confines of the cranium and the spinal cord can cause great neurological difficulties and death. All right, Jason. So, kind of a downer, right? Going through
Very
all that
much so.
stuff. So, Jason, you were first diagnosed in about 2005.
Right. Yep.
Can you tell the listening audience, what happened? Tell your story from about when you were diagnosed.
Okay. Thank you all for listening again. I'm still alive, very much alive, and it's good to be here. And,
That's right. That's Jason.
Yeah, and I'm still here. Thank God. It was an interesting journey. I was doing some remodel in my home, and I pulled an ab muscle, so I went to the doctor, and he just told me it was a torn ab muscle, and so he prescribed some like Flexerol.
Okay.
And he said, as I was going out the door, he said, why don't you go get a scan? Let's go look at that tear. And so that's what started my journey. So I went.
So it was by accident, basically.
Absolutely, yes.
Okay.
So.
So they did a scan in your abdomen.
Right, a whole, abdominal scan, and I knew something was up when the technician would say stuff like, "Does this hurt?"
Mm-hmm.
And then, "Does this hurt?"
Oh.
And I said, no. It was up to that point. There was like no pain.
Okay.
Where they were directing it should be, and I didn't feel it at all.
Yeah.
It was just where I kind of pulled my muscle. That was
Okay.
about it.
And then I guess somebody looked at your scan.
Yes, in fact, the very same day I got the call from my doctor, and I knew that couldn't be good.
When he called you that fast.
Yeah, and he told me to come down to his office and we have to talk. So I showed up, and he started showing me things, and
You mean on the scan?
yeah, started
Okay.
talking to me about my kidneys, and we're talking like both kidneys,
Mm-hmm.
and both of them, it didn't have that kidney shape So I was going, wow, that's pretty. What is that?
Yeah.
And as we started talking, it started to register in my head that I will be under the knife very soon. And we don't really know what this is, but it was something that was going to have to be dealt with very soon.
Okay.
So,
do you recall about what date that was, or at least what month in 2005?
Oh, that was probably about like Halloween.
October 2005?
2005, yeah.
Okay.
And so...
at that point, no one knew it was von Hippel-Lindau disease?
No, not at all, not
okay.
at all.
When was the surgery?
Right after Thanksgiving.
Okay.
Yeah. So it was kind of like my last meal. Okay, I really better enjoy this Thanksgiving.
Okay. But at that point, you just thought you didn't know what it was. It was a tumor of some kind.
Well, we're talking the C word. We're talking cancer here.
Okay.
So that was out on the table.
Okay.
So,
all right.
I can say cancer now. At
Yeah,
that time, it was hard for me
to say it.
Yeah.
Okay. I can understand that. Okay. And then what happened after the surgery?
I knew I was going to get another surgery because I had bilateral kidney cancer, so that's both kidneys. So my doctor decided to cut me through the front. It's kind of like this.
Okay.
Like this big V on my abdomen. And I could see it. I was going to be opened up like this for several times, like the biology frog thing, the traditional going through the sides for your kidneys. He said it would be cutting through a lot of tendons and ligaments or whatever.
Yeah.
And he said it'd be more painful to
recover.
Heal. Yeah, and I'd suffer from pain down the line. So this was, I just went with it. I said, okay, if you say so, let's do it like that.
Yeah. After the surgery, they sent the tumors to pathology.
Right. And the tumors go to pathology. I'm in the hospital. He comes and he says, surgery was a success. We got the cancer. You have cysts in your kidneys, and unfortunately these are testing positive for cancer. So recurrence now is on the table, and they still haven't done the other side. They could only do one at a time because they were too afraid I'd shut down and I'd lose both kidneys right there.
Right, if they worked on both kidneys.
Right, so they just do one at a time. So they open me, close me, a couple months later, do it again, do the other side.
The cysts, when it comes to von Hippel-Lindau disease, a lot of the cysts, because cysts typically don't cause much problems, but with VHL, these cysts have an enormous chance of becoming malignant, and that's what was being found in your cysts.
Right, it was looking very grim.
So the surgeon, do you know which kidney he operated on first?
I believe it was my left.
Left. So he left the cysts in your left kidneys.
Well, my surgeon and I have become very good friends over the course of this, and it was I saw him at a time where he had to give me like bad news.
Yeah.
Right after the surgery.
Right.
And I saw frustration and anguish in his face. He drew a picture and he says, "We cut this off, and you have like cysts in your kidneys, and a lot of people have it, but you have it like this, and they're testing positive for cancer. And for me to cut out each of those little, your kidney's going to be like Swiss cheese. It probably won't function after that." So
right, and that's why you're saying you're going to have to go again on the left kidney again, because they would become cancerous and you would have to remove them.
It was looking grim, yeah.
Okay. When did you find out you had von Hippel-Lindau disease, though?
That didn't happen till after the second surgery.
After the second surgery, okay. Tell us about the second surgery. About when was that one?
That was like, I had my first one December 5th, 05, and the second one was February 6th,
2006.
06. Yeah,
Okay.
so just a couple months, and then back under the knife. You know, it was.
Yeah, pretty hard.
Yeah, it was very scary.
Yeah. Then after that second surgery, you were in the recovery room or in your room, and your physician came in, or your surgeon came in, and what happened?
Again, that's when he was like, he really drew me that picture with the cyst and where we're going to go from this point is very hard to say. It's pretty much looking like we're going to be going in and out and in and out. A lot of there's going to be a lot of surgery in my life down the road.
Yeah. Yeah, it's not uncommon for people with VHL to undergo 2 to 3 surgeries a year, many years in a row.
Right.
Yeah.
And so we're looking at that.
Yeah. All right, and he told you about the cysts are malignant and they're going to turn into cancers down the road, or a clear cell carcinoma or renal cell carcinoma down the road. How did the diagnosis for VHL come about?
That came about through, well, I had some, while I was going through all this, we had like genetics people working, they were working on my case too, and they had narrowed it down to this thing called like tuberous sclerosis or something.
Okay.
And so we were kind of riding along on that. Then I had like a epididymis thing.
Okay.
So that was like a small surgery, but another one nonetheless in between all these big ones, and we had that removed. And from that point, that was like the clincher for the VHL.
Okay.
So that's what said all of a sudden from tuberous sclerosis. Now we're looking at VHL.
Okay. You also had some, I guess, retinal-hemangiomas also.
Oh, no, not really.
Oh, okay. Because I know you had mentioned your ophthalmologist before.
Yeah, my ophthalmologist has several VHL patients, and he actually said it was kind of interesting that I was telling him that I have VHL, because normally he is the one who sees it first. He'll see it in his patients in their eyes, and he didn't see it in my eyes. So, you know, he had no reason to believe I had that, and then now it's kind of reverse. I'm telling him I got it, and he's looking and goes, well, I don't see it there.
Yeah. All right. I guess that's a positive thing.
Yeah.
But, yeah. All right, Jay. So, you know, there are many different types of VHL, right?
Right.
The worst type is the type that have kidney involvement, and typically the malignant kidney involvement, which you had. So you had the worst case scenario.
Yeah, that's pretty bad, yeah. And there's also the brain and spine thing, which I, thank God, I did not have.
Yeah. So you had like brain scans too?
Absolutely.
Okay.
I went through that.
All right. So Jace, you know, they told you now you have this thing called von Hippel-Lindau disease. Obviously you didn't know what that was.
No.
So I guess you went home and did some research.
Yeah, well, first I went home and stayed in denial for a while, you know. I had papers on it. I started reading it. It's not something I could like read at one crack. I just like get to a paragraph and it get kind of tough, and then I put it down and do something distracting, you know. So then
yeah, I can understand.
It took a while for me to get through all of it, you know.
Yeah. I can understand that. I mean, you know, just reading it for the audience, I mean, you know, it's hard for me to go through because I know you're here with me.
Right.
And I'm sure it's pretty hard for you to hear it too, again.
It is. It's hard. And I'm still functioning. Like people that get it in their brain and spine, they're like paralyzed. And,
right.
And it's pretty degenerative. They get worse and worse as it progresses.
Once you accepted that you had this thing, von Hippel-Lindau disease, tell us what you were feeling.
Despair. absolute rock bottom despair.
Mm.
It was very hard to sleep. In fact, I didn't sleep. I'd sleep maybe about an hour a night.
Yeah.
I try to like do physical things, or when I get back to work, I try and work
Yeah.
until I like burn out, and hopefully I'll go home so tired that I'll just drop in bed and fall asleep. The moment I do that, I'm awake thinking about this
Thinking
thing.
about it again.
Yeah, it's, and my mind is just
Yeah.
spinning. And
So, so you try to do a lot of things to keep your mind off of it.
right.
And then, so it does make sense. I mean, no one wants to believe they have this thing that's incurable.
Right.
Right.
It's,
What did your doctor say about von Hippel-Lindau disease? What kind of treatment did they offer?
surgery.
The only treatment?
That was it. The carcinoma that I had was something that doesn't respond to chemo or radiation. So you're looking at surgery and surgery.
Did your doctor tell you your prognosis at that time?
He sure did. Yeah.
He did?
Yeah. It. And again, I saw it on his face. It was. He didn't have his happy face on. You know. It was pretty grim, and you know, at best maybe I'd end up like on dialysis. You know. So.
Okay. Yeah. All right. Once you came to grips with that you had this von Hippel-Lindau disease, what was your next step? What were you thinking of doing?
I was pretty much lost. You know, and
what can you do? I guess you're thinking.
Right, and I just thoughts of how long can I endure this, and
how long are you gonna live?
Right, it was very grim.
Okay. You had your second surgery on your right kidney, the first surgery on your right kidney in February 2006. When was your third surgery?
My third surgery was...
I should say your fourth, because you had a epididymal surgery.
Well, that was between my...
First and second.
The second and third.
Second and third,
big
okay.
surgeries.
Yeah.
So I had like 4 big major...
surgeries.
This open up the biology frog thing. You know?
Poor guy. I'm sure not too many people were wanting to, study you that way. But you had mentioned before on TV as well as on the radio the chevron cut.
Oh yeah, that's it's kind of like that Chevron service station thing, but you turn it upside down. You know, that's what it.
That's how your abdomen looks like.
Yeah, it's
Yeah. So they opened you up.
Yeah, it's not like I got, abs and bricks and stuff like that. Those are scars.
No chance for little microscopic type surgery.
No, I was hoping,
All right, Jace. When was your third major surgery or third major abdominal surgery?
That was May 07.
May 07. So a little over a year after.
Right.
So that was before you came, after you came in to see me, actually.
Right. Yeah.
So I know you're feeling pretty down after the second surgery, after the diagnosis of Hippel-Lindau disease. You had told me before that you and your wife decided to take a cruise.
Oh yeah.
To Tahiti.
Yeah, that's right.
And I
did that. That was. I really needed distraction.
Okay. So I can understand that. I guess you're thinking, man, I'm gonna enjoy.
Right.
Yeah, I'm gonna enjoy my life somewhat, right?
That you saying that kind of brings up. A lot of people were telling me that, like I was gonna die. Like when people say you should enjoy yourself.
Yeah.
And I know they mean it from their heart that they feel for me and. What can they say, but I hear it as like, oh, they see me as like, pretty much a walking dead guy,
Yeah, dead man walking.
Yeah, so when I would hear that, you say, it kind of brings it all back. Yeah, wow. Yeah, people were telling me to enjoy myself, so I'm going to go to Tahiti to really enjoy myself. Yeah.
But that was the idea, I guess.
Yeah.
When did you guys go to Tahiti?
Oh. I have to ask Olivia about it. That was
February 2007.
Yeah.
Oh, okay. So sometime after that. Well, that we can talk about Tahiti another day.
Yeah, it's very nice.
Okay. So from February 2006, you had a long wait till May 2007 until your next surgery or your third abdominal surgery. What was going on during that time? Because during that time, eventually you made your way to find me in naturopathic medicine. Can you kind of give us the scenario of how all that came about?
Sure can. That during the course up to this point of this condition that I had, people, friends and family around me really wanted me to live through this. So with all their heart and good intention, they would bring me things that cures things. You know, and it's I had boxes of things to drink and to eat and take this and that, and you know, I was kind of spinning from it. I mean, my heart goes out to them. They really
want to help.
Their love for me, yeah, I could see. But then on the other hand, if I take all this and I get better, I don't know which one is the one. You know? And so what? I'm going to have to keep getting all this stuff, you know?
Or taking all of it.
Right. It's just insane. And then Olivia started talking to me about this alkaline diet thing. And that's the path we chose.
Okay. Olivia, would you mind telling us how you discovered the alkaline diet?
Sure. Let's see, when I found out that he had von Hippel-Lindau disease, I was in shock, in denial, angry, and just everything. And I was just searching and searching. And at that time, a friend of mine and a client of mine talked to me about alkaline diets, that by changing your blood pH level towards alkalinity, your body was stronger. It could fight off a whole list of pathologies that we were going over. And I said, do you think it would help with cancer? And she says, why not? So I read into alkaline diets and, you know, and found out how restrictive it was. And I was going, there's no way this guy is going to do this. But you know what? I said, I told him, you're going to do this because you're going to live. I practically forced him to do it. I said, you're going to do this because I am not going to do this alone.
All right. So you did some research on the acid alkaline pH and the theory of the alkaline diet. But how did you make that leap then to have Jason come in and see a naturopath?
Well, my daughter was very supportive of, you know, the emotional ups and downs that we were going through. And her boyfriend at the time had a friend who was listening to your radio show, and he brought a cassette of one of your shows. So I played it one night for him, and he wasn't, I don't know if he was listening, but I played it as he walked back and forth in the kitchen and living room, and I decided then, I said, you know what, let's go. So I made the appointment. But the first appointment, he canceled, so I came to see you.
Yeah, I remember that.
Yeah.
So I guess you wanted to keep that appointment.
Yeah. And so I made a second appointment, and I told him, you have to go. You have to go, or I will drag you there myself.
All right. And then Jason came in to see me in April of 2007. And Jason came in, you know, we were told ahead of time that Jason had von Hippel-Lindau disease, which was a good thing because, you know, I had never heard of that illness myself because it's so rare. It's 1 in every 32,000 to 40,000 people. And, you know, Jason walked in and, you know, I looked at Jason. I said, well, you know, Jason, you know, I haven't treated this before, and I don't know if we can help you.
I remember that.
But and Jason went on and said, well, they were interested, or he was interested in the alkaline diet, and I said, you know, that would be the way to go. if we were to try
Absolutely.
to beat the von Hippel-Lindau disease. So Jason, I'm going to just share a little bit about the alkaline
sure.
diet. So the theory behind the alkaline, making our body's pH slightly more alkaline, is that actually disease, including cancer, cannot grow in an alkaline environment. So the body's pH, or I should say pH, ranges from 1 to 14, 1 being very acidic, 14 being very alkaline. The human body's pH is fairly neutral at about 7, but the theory is that optimum pH for the human body is about 7.35 to 7.45. So the idea is to get Jason's or anybody's pH in the 7.35 to 7.45 range. But to do that, it's pretty strict, like Olivia was saying. So basically, to do that, that person has to eat fresh fruits and vegetables. That's the majority of the diet. They have to eliminate all processed foods as well as meats, because processed foods and meats make the body more acidic. Processed foods are degenerated, so because they are degenerated, the body has to put more acids in the stomach to break it down, as well as meats, very hard to digest, so the stomach has to release a lot of acids. So when the small intestines tries to reabsorb or absorb the nutrients of the protein, some of the acids is absorbed too, making the body's pH slightly more acidic. And beans and whole grains are neutral, so Jason had to eat basically fresh fruits and vegetables, beans and whole grains, and some fish.
Mm-hmm.
Pretty
That
strict.
was yummy.
So Jason, when Olivia told you what type of diet you have to follow, well, what were you thinking?
Well,
did she tell you that, by the way?
yeah. She showed me a paper.
Okay.
That was looking pretty grim.
Made you more depressed.
Yeah. But it was a matter of I had to weigh it out. Now, what do I want to do? I want to try this. I'm going to do it wholeheartedly. And I had to get a mindset of, I just have to be very conscious of what I put in my mouth.
Mm-hmm, mm-hmm.
And by doing this, I'm hoping and praying that this will be the one, and I won't be on all these, whatever these things to take, and more surgery and all of that. So,
Right.
it was shifting my mindset to accepting this.
Was that hard to do?
Initially, yeah, it was. We had to kind of do it in steps.
Yeah.
It was a graduated thing, and for me, the tough thing was sugar. I had to cut that out.
Yeah.
Sugar was very tough. It took me about 2 weeks of pretty much cold turkey, no sugar. And after that, though, I must admit I didn't have the craving for it.
Yeah.
So,
Did you like sugars before?
Oh, absolutely. I could.
Like everybody else.
Okay. I love cake and ice cream stuff.
Okay. So sugars in themselves is very acidic, and when we put it in our body, it becomes even more acidic. So even packaged, boxed, jarred juices is acidic. So even though it comes from fruit, because it's not fresh, the fruit in itself starts to ferment and become more acidic over time, and that's why it has to be fresh fruits and vegetables as well as fresh vegetable or fruit juices. All right, Jay. So tell us what happened in May, because you came in to see me in April.
Right.
Changed your diet about 2 weeks later, I guess, or radically in about 2 weeks later.
Right.
And then you had your surgery in May, the third one in your abdomen.
Yeah, so prior to coming to see you, Olivia had already started me on the diet.
Okay.
And it was, like I said, graduated, getting into it. And then when we saw you, it got fine-tuned.
Okay.
So it was very more specific, and then
black and white.
Yeah, absolutely. There was no. And then I had the surgery, and what was amazing was after the surgery, my recovery was very quick. I bounced back noticeably faster than the prior two. I thought I did pretty good on the first two, after all that major surgeries like that. But this third one, I remember being on my bike about a week after. I got back on my bike. I said, "Don't fall down," but I did get on the bike and I did ride, and that was like my big, I'm gonna get through this thing really, and it was noticeably quicker this time around.
I remember you had mentioned that
Yeah,
you did get on your bike real soon after your surgery.
Yeah, it was very soon.
And you did recover a lot faster.
Yeah.
Whether it was because of the new treatment or not, we don't know. But at least you recovered faster than the first two.
Right.
And this is your third one.
Very noticeable. Yeah.
Yeah. All right. We also put you on some supplements too. I don't want the audience to think that it was only the diet that changed. We gave you a few supplements, more than a handful.
Yeah.
That basically what they do is try to stimulate Jason's immune system, his white blood cells, to make more natural killer cells. Natural killer cells are specific white blood cells that fight cancer. So we needed to increase those numbers to try to help Jason's immune system fight these tumors that are developing nonstop because of the defect in the gene. All right, Jace. And then you had a fourth surgery. When
Absolutely.
was that?
That was in August, early August.
Early August,
yeah.
2007.
Yeah.
So this is, I guess, 4 months after you started the treatment with me.
Right. And that again, it was getting to be like, unfortunately, a routine, where I kind of know what's going to happen. And I remember being in my hospital room the day after, and my surgeon comes in and he's going to let me know what's going on, and so I'm ready for this, And he starts telling me, like how he usually did, that the surgery went well and we got all the cancer. And this time around he goes, there's something interesting I have to tell you about. I go, okay, lay it on me, and I'm open.
Yeah.
And he says, well, your cyst came back from pathology, and they're testing negative for cancer. And he looked at me almost beaming, and saying, what did you do?
Why did he say that?
It was a miracle.
Because it doesn't happen to go from positive to now negative.
Yeah, it was an absolute miracle.
Yeah.
And he wanted to know.
He knew you did something.
Yeah, he goes, what are you doing? Something's going on here.
Mm-hmm.
And in a very positive way, he was really. It was interesting for me to see that he showed a genuine interest in what is going on now.
Yeah, how come this change is happening in this person's body?
Yeah.
Did he tell you why he wanted to know what you did to help yourself reverse this von Hippel-Lindau?
It was actually a personal thing for him. In case, he... I doubt he'd ever get what I got, being one in like 40,000,
right.
But there's many other pathologies that come
genetic
along in
illnesses.
life, and
so he wanted to know for himself.
Yeah.
Yeah.
What did I do?
So you out there in the listening or viewing audience, you want to remember that the surgeon wanted to know what Jason was doing so he could help himself. So.
It was interesting. We had a nice conversation, and
it must have been a good day for him.
It was, absolutely.
Not to make your day not being good, but tell us how you felt that day after you talked to your surgeon.
It was pretty much hallelujah. Olivia and I, we had spent our anniversary. It was during that time. It was our anniversary. In the hospital. And we spent it in the hospital.
We prayed.
Yeah, we sure did. I wanted to get down on my knees and thank God, and I couldn't though. I was all hooked up. but we did do quite a bit of praying and thanking God for His awesome grace and the miracle.
I'm sure.
It was miracles, actually.
Yeah.
He rained down on us.
It is a miracle, right?
Absolutely.
To go from having von Hippel-Lindau, having positive kidney cysts, and now they're negative. It doesn't happen that you go from positive to negative.
Yeah, that was very... I got that from him, that it was...
Jason, you mentioned you prayed a lot. A lot of my patients who develop cancer, they really become religious because of the big C. Can you tell us how you became religious, and tell us the support that you got from your church?
Maybe not, I don't know if religious is the word, but during the beginning, during the course of this thing, I did turn to Christ. Absolutely, I accepted Him in my life. It wasn't so apparent to me at the beginning, but as I started to go through these experiences, I always knew that I had the Lord with me going into these surgeries. I was not alone.
Mm-hmm.
One thing I'd like to mention is that every time I go through these surgeries, they get me on the IV, and then I'm on a little sedative, and just before they wheel me in and knock me out, I gotta sign this release saying, in the event, and I have to sign that, me, my family not going to sue the hospital and all this kind of stuff. It's like, you really start to wonder, every time you sign that, your life kind of runs through your head. And going through all of this, it was comforting to know that I did have, like, Jesus on my side.
Mm-hmm. You had a lot of people praying for you, too,
Absolutely.
during these surgeries.
There was, like,
right?
not only my church, it was, like, many other churches, all these prayer chains. It was pretty insane, amount of people that... And to all of you out there, thank you, and, you believe in the power of prayer, because... I am living testimony that I really should be dead, but here I am. So.
All right, amen.
Yeah, hallelujah.
Olivia,
Yes.
when you heard the news that Jason's malignant cancers now were benign, or they weren't, they were just cysts, just plain old cysts, which basically is, of no consequence, what were you feeling at that time?
I was angry. I was angry at everyone, everything, everybody.
Oh, when Jason was diagnosed with Hippel-Lindau disease, okay.
Yeah, I was angry that he had that, and there was nothing I could do. It was beyond my control, so I put everything that I knew and felt on God's feet, and just asked Him to be with me.
That's the thing about genetic diseases like von Hippel-Lindau disease. Basically, no one has control. The doctors don't have control.
No.
You, the patient, doesn't have control.
Not at all.
And it's really a mystery looking out into a void, basically,
Absolutely.
right? After you guys got the good news that Jason's von Hippel-Lindau disease had changed for the better, what were you thinking and feeling?
I was really glad that I actually forced him into doing that alkaline diet. I was glad that I forced him to come and see you, and I was glad that he was, at church and praying to God. So, all in all, it was a total package. So it was great.
This path was all orchestrated by the Lord. So, despite its ups and downs, it is how it was meant to be.
It is amazing.
There was quite a bit of growth between the two of us that occurred during this time, and those little interactions we had were necessary for our growth.
Yeah.
So.
No doubt, going through something as harsh as this, you do need a lot of support, because to go through it alone, it's got to be really a heavy burden. So you guys probably did share a lot during that time.
we sure did. And there was a lot of strange emotions that came up that we did not know what it was. And there were times we took out, our frustration on each other just because we don't know. We're staring at the void here.
Yeah.
And
a lot of questions.
A lot of questions.
Frustration.
And
Jason, had you ever heard of naturopathic medicine before you came in to see me?
no.
Well, you're not alone. Hopefully more and more people are learning about naturopathic medicine now, though, but...
it's like, what? What is that?
What do you think of it now? I mean, you had no...
very real. It's truly a gift from God. It's a miracle. And I must say, there are many miracles that happened to me during the course of this thing that it got really bad. And there are many times, during the course of all these surgeries that it got even below rock bottom. Like, there was really going to be no good coming out of this thing.
Yeah.
Getting kind of lost there.
Yeah, I could imagine. But I guess your recovery after the third surgery, after you started the new diet,
it started to
kind of helped you
give me hope.
Yeah,
absolutely. And even for Olivia and I, we were like getting more and more involved in our church and everything, and so there was a lot of support coming from that. And what testimony we did share, it was like sharing these little... It's a modern day miracle, actually.
Mm-hmm.
And,
I mean, it is.
Yeah.
That's what I opened up with. It is incredible that you're sitting here with me tonight.
Absolutely.
So would you like to tell the listening audience something about your experience with naturopathic medicine and overcoming, or what would you like to say to somebody who has von Hippel-Lindau disease or who is cancer in general?
First, seek the Lord and ask for guidance, and I'm sure you will be guided.
Yeah, but you have
to a naturopathic path. I believe that's how it. Seriously, I believe that's how I came to you through Olivia and through this path, because I was presented with many options, and to choose this out of this whole array of remedies.
Mm-hmm. It was destiny,
right? And so why is it that I chose this?
No other explanation.
Yeah, and then when I did do it, although it was tough, we did it wholeheartedly.
Yeah.
Would
you like to share with the listening audience how easy or hard that diet was?
It takes a little getting used to, but kind of ease into it, but stick with it. As time goes by, you'll notice you have less and less cravings for these other things that you eat. And I'll admit I'm not so full on my diet anymore. I take little breaks, but still I come back, and you can tell when okay, that's enough, and you come back and you just feel better, and it's a good whole body feeling you get from it.
So no matter what somebody's situation maybe, no matter how dark it might seem, you for one can speak for any one of those people.
Yeah, absolutely.
It's not, there's no such thing as no hope.
No, there is always hope.
Mm-hmm.
Yes.
Jason, most individuals with cancer, once the cancer is removed, no matter which way they go, surgery, radiation, chemotherapy, the cancer is gone, they can relax. But when you have von Hippel-Lindau disease, because you have a genetic defect, your tumor suppressor gene is defective, it doesn't work, it means that you can't relax.
No, there's no remission in my vocabulary.
Mm-hmm.
So it is something that I'm pretty much going to have to do for life. And I'm in that mindset that this is how it's going to be, and it's really not that bad to, to think that, just from what I put in my mouth,
Mm-hmm.
I was able to like overcome a disease of this magnitude. I still have it.
Mm-hmm.
I will have it, till the end of my time. But by staying in my mindset, I will be able to live with this and live pretty well with
Yeah,
it.
overcome it.
Yeah.
All right, terrific, Jace. Unfortunately, there's another side to this too, because I don't know if your family has VHL, but basically, you may have passed it on to your children.
Yes, very aware of that.
Right.
Yeah.
Do you know if your children have VHL?
No, but we've had the talk.
Okay.
So my kids are old enough to
Do their thing.
Yeah, and they are well aware that they will be tested, and they're willing to do that,
Mm-hmm. Mm-hmm. Not necessarily mean that they do have it, but because yours might have been a mutation in itself, a spontaneous mutation.
Yeah, that's what it was.
So if your children don't have it, it could have been that was the case. Because you were diagnosed, I think, slightly older than most people.
Yeah.
Yeah. All right, Jace. When did you have your last MRI or CAT scan?
Well, that might have been like about a month ago.
A month ago.
Yeah.
All right. And what was found?
Oh,
what wasn't found?
First of all, I don't do MRIs or CAT scans anymore because
right.
it's been so good. We just do like ultrasounds,
Okay.
and it's been very positive.
So your last ultrasound was negative for
Negative.
any type of cancer?
Yeah, absolutely negative.
Congratulations.
Yes.
The reason why they don't want to do MRI or CAT scans is because...
Oh, because they have to put like a dye in me, and those dyes, they kind of have an effect on your kidneys, and my doctor doesn't want to subject me to that under my condition, so...
Yeah.
Yeah, let's
So,
just do ultrasound.
Right, so that's a good move.
Yeah.
Have you seen your surgeon recently?
Yes, I did, probably about a month and a half ago, and it was all good news. So, praise God for that. I'd still get a little nervous before I go in, but
I'm sure.
I must say, it's almost like I know what the outcome is going to be. It's
Ahead
gonna
of
be all
time.
good, yeah.
All right.
Hallelujah.
Oh man, Jason, thank you so much for joining us tonight. It's always good to see you. Thanks
Yes.
for sharing your story again.
Yes, absolutely.
Olivia, thank you so much for coming on with Jason. I know,
Thank you.
It's not a thing you want to relive all the time, but it's a really, really beautiful story.
Yeah, to share this, especially for people out there with facing cancer, please consider something like this kind of treatment, or go down this path,
Naturopathic.
Yeah, naturopathic medicine.
All right. Thanks a lot, Jason.
Yeah.
Thank you, Olivia. I'd like to thank all of you for tuning in and joining us today. I hope you enjoyed the program and learned something of value. Please continue to look for and tune into Island Wellness on Olelo Television. My name is Dr. Jason Uchida. Goodbye.